Hello again. So South Africa has recorded 16,055 more cases in the last 24 hours for the first time in months. This has pushed the country past another grim pandemic milestone, as more than 3 million infections have been confirmed countrywide since the outbreak. The positivity rate has also jumped to 24.3%. The majority of new cases are from Gauteng, accounting for 72%, just over 11,000 cases. The Western Cape has registered 957 cases, KwaZulu-Natal 897, and the Northwest 805 cases. A further 25 related deaths have also been logged in the same period. We get you the latest on these trends. We're joined by Dr. Nicholas Crisp. He's the Deputy Director General of National Health Insurance. Thank you very much for your time this afternoon, Dr. Crisp. As we are reporting the numbers, has there been any changes that you pick up from that introduction?
Afternoon, Julie, and afternoon to the viewers. No, those are the figures. I just want to make people clear that the figures you're referring to are just yesterday's reported cases. So the National Health Institute for Communicable Diseases reports in 24-hour cycles, and the figures that are reported are those tests that are positive from the previous day's tests around the country, both in the public and the private sector. So when we talk about 11,000 cases, we're talking about 11,000 in 24 hours. That is not the cumulative total, and as long as people understand, this is the numbers are growing rapidly.
Right. You say the numbers are going up rapidly. We're using terminology such as, alarming and, these cases are unprecedented, if you will. Are we correct in capturing it that way? Is that how you would characterize it?
So let's try and explain a few things that we are seeing. You'll hear the word in the public, transmissible. So that is how we pass the virus from one to another. And when viruses are very transmissible, it means we pass them easily between one another and the numbers go up very fast. So that's what we are seeing with this. We are passing the virus between one another very fast. This particular virus is able to move between us quickly. If a virus is less transmissible, which Delta was less transmissible than this one, it still passes readily between us, but not as easily. And the message in that is to keep our distance, to wash our hands, and to wear our masks, because we know that this is how this virus moves between us. That particular term does not refer to how virulent or aggressive or how bad the disease is out there. It's merely talking about how many of us are going to get exposed and get sick. That sickness may be mild, it may be severe. We don't have enough information yet to be very definitive. We do see large numbers of mild infection, and those people will normally be either stay at home or they will see a general practitioner or go to a clinic, and there are large numbers of people with mild infection. The problem is that there are people who are getting severe infection and very severe infection and are ending up in intensive care units on oxygen, and we have been informed of at least one death so far. So I want to make it clear to the public, we don't really understand. Do not be complacent. Yes, it may be that there's lots of mild infection out there, but there is definitely sufficient serious infection to spoil people's Christmas, to spoil everything that we do, and to keep the healthcare workers very busy over this period. So please get vaccinated, wear your mask, wash your hands, and do everything that you are asked to do to prevent the spread of this disease.
Public health specialist at the National Institute for Communicable Diseases, Dr. Wasila Jasat, in addressing the media yesterday, also talked about more children being hospitalized as a result. What do parents need to know?
So what we have seen is that, and this is not unexpected in any way, we do see children being infected, but this time it's more children than we saw in previous waves. We don't know if it's just that it's this time of the year and the children are quite sociable, and I'm talking about children and adolescents. People are finishing exams, they're moving around, they're planning parties and so on, and that is a a very ripe atmosphere for transmitting the disease from one to another. But we have seen very young children this time, which we did not see so much in the past with the other waves. So, as you know, we are vaccinating from the age of 12 and up, and about 572,000 adolescents have been vaccinated so far, and it seems to be increasing all the time, and we are encouraged by that. But we don't have a vaccine that we are using in South Africa for small children. So if a child is infected and the parents are worried that it's anything more than a mild infection, I would advise them to see their practitioner or go to the clinic and not wait until the disease gets worse, because some of these infections are definitely developing into worse infections, and it seems to be able to happen quite rapidly.
You have stressed a number of times in this conversation that there's still work that is being done to get more information on this, right? But what have you found? Is there an immunity gap between vaccinated and unvaccinated?
Yeah, and so Judy, what we have seen is that vaccination definitely protects people, because we are seeing fewer vaccinated than unvaccinated people in hospital. But it does seem that this virus, as we were warned a week ago by the scientific community, does seem to be able to pass infection to those of us who have been vaccinated. But it appears that the vaccine, and this is what we are seeing so far, is protecting against severe illness. And that's what we want. We don't want people to get severely ill. If we have the sniffles or we get a cough and we feel terrible for a few days, that is not going to clog up the hospitals, and we will get over it. But for those who develop symptoms and end up with severe infections, it can deteriorate to a situation where you end up in intensive care units and may even die. And that does appear to be far more prevalent in unvaccinated people than vaccinated people.
The Vuma vaccination drive underway this weekend. A few moments ago, we heard from the Premier of Mpumalanga concerned that not as many people as they would have liked to see are coming out to get vaccinated. She did allude to the fact that it perhaps could be because it's month end and people are out and about doing their own things. What informs when you pick a time to vaccinate people?
Well, it's availability of resources. Right now, we want to be vaccinating people all the time, every day, everywhere we possibly can. We have administered 26.3 million doses of vaccine, and 17 million individuals have received the vaccination. That's about 42.8% of the total adult populations had at least one dose. But only 14.7, which is 37%, have been fully vaccinated. Of course, we are at the moment vaccinating healthcare workers as well, giving booster doses because they were vaccinated more than 6 months ago. And we are vaccinating adolescents, as you're aware. But we need to vaccinate everybody. We need to protect people so that they don't end up with severe illness. And the more people who can come to vaccination sites while they're open now over this weekend, and during the course of next week, the better. We have the capacity to vaccinate almost double the number of people who are coming at the moment. So we are seeing in the order of about 150, 160,000 a day at the moment. And between the public and the private sector, we are able to vaccinate closer to 300,000 people a day.
You have the capacity to vaccinate double of what you are currently seeing. Where do you think the gap is, right? And I'll ask you this because the Premier of Mpumalanga was talking about perhaps collaborating with leaders of churches and pastors and priests and so forth in order to get this message across for people to vaccinate, because we see them not vaccinating as well. What do you perceive is at the heart of people not coming out, and what needs to be done?
Judy, we've been following this for a long time now, trying to see who comes and who doesn't come. So there are people who are just hesitant, and if the time is not right for them, they don't see the particular need. Maybe nobody in their family has been sick and nobody that they know has died yet, so they let it slip. Then there are those that are genuinely concerned because they read a lot of mixed messages and untruths on social media, and they really don't know what to believe, and they stay away. Then there seems to be a group of people, younger people, who believe they won't get the virus. I'm young, I'm going to be fine, based on trends that we saw in previous waves. This wave is very different, and we now know that COVID doesn't discriminate. It affects anybody. So there are those groups, and then there's a small group, which according to the research we've seen is somewhere between 6 and 7% of the population who outright refuse for whatever reason to be vaccinated. The problem is they're very vocal, and these people believe that that the virus is a myth and that the vaccines don't work, and that group is doing untold damage all over the country and putting a lot of people's lives at risk. And I would really encourage the public to get the real information from the official websites. And if you're still not sure, go and see your doctor. And if I can add one more thing, there's a lot of disinformation around whether vaccination should be given to pregnant women. We strongly encourage pregnant women and women who are breastfeeding to get vaccinated. We have had reports of numbers of pregnant women being admitted in hospital now during their pregnancy with COVID, and that makes them more vulnerable and obviously makes the baby and the pregnancy vulnerable. Please, all pregnant women and everybody, all women who are breastfeeding, please go and get vaccinated.
Dr. Crisp, perhaps finally for us, I mean, in terms of, saying that we have capacity to vaccinate double than what we are right now, how far can these vaccines take us before they are unable to be used?
We've got a long way to go. So what has happened is that some months ago we ran low on vaccines because the Johnson & Johnson deliveries had not started yet, and we got a large number of donations from the United States, which got us out of trouble. There were more than 7 million doses donated at that time, and we were still vaccinating at quite a good tempo, and it picked up a bit after that period of running out of vaccine in a few sites. But since things have started to deteriorate, we have accumulated vaccines to the extent, as we have said in public, that we have asked our suppliers to delay some of the deliveries into the new year. We are sitting with over 19 million doses of vaccine in the country at the moment. They don't start to expire until somewhere after February next year. And each consignment that has come expires at a different date. So from February, March, April, May next year, the vaccines will start to expire. So we have a lot of vaccine. We have a lot of room before they start to become problematic. But once they're out of the central store and they're into the periphery, their expiry date is reduced dramatically, and those vaccines need to be used pronto. We have lots of vaccine available at vaccination sites, private pharmacies, private hospitals, government sites, clinics, pop-up sites, all over the place. And I would encourage the public to find out from any of the pamphlets and the websites that are available. Listen to the radio. There are messages going on all the time at the moment saying what to do about vaccination, and go and get vaccinated.
Always a pleasure. Dr. Nicholas Crisp, Deputy Director General at the Health Department. Do stay with us.